Welcome back to Body Beautiful. We are talking right now with Dr. Elizabeth Lee, discussing ways to freshen up your look for those holiday parties and maybe for that new job you want for the first of the year. First, let me remind you that we will be taking your calls live on the air with any questions you have for the doctor. The phone number 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you always want a second opinion. Okay, you made this list, this Santa's list. You can do one, or sometimes you do combinations.
Absolutely, and the point of the Santa's list is to be able to give patients the opportunity to kind of splurge, do a full correction, even if that means a treatment site with one of the botulinum toxin products and 2 cc's of a filler. So we're trying to offer a discount, not to encourage them to do more than they need, but to give them the opportunity, because you're getting money off per cc.
Right. So you were saying the photographs,
right,
and you saw some improvements, and the people were smiling like at the end, and
right.
I don't know that you. They just, what does that do?
Well, people are really happy with these products, and you know, unfortunately, they don't. The procedure doesn't really show in still pictures. It's really about animation, about the fact that the face is still moving normally. And what I get back from patients is, nobody knows I've put fillers in my face. Nobody says this, but everybody says, you look great. What have you done? And the most common question is your hair color different?
Yeah, well, that's the greatest compliment. You don't want someone to see the work.
Right, and that's my goal at all times, is to have natural looking procedures.
All right, let's go ahead and go to the phone lines. We have Deborah from Santa Clara. Good morning.
Hi, good morning.
Hi.
You have a question for Dr. Lee?
Yes, I do. I'm 59 years old. I have pretty good skin. However, I have those estrogen lines below the nose and above the upper lip.
Estrogen lines.
So you mean you have
driving me crazy?
You mean you have vertical wrinkles around your mouth? Okay. So you know, I need to make definite recommendations in person. But what very often happens is that we lose some volume in our lips as we age. And while nobody wants to look like any of the caricatures we can think of out there with overdone lips, the fact is that some gentle refilling of the lips with a hyaluronic acid product, like with Juvederm or with Restylane, will soften those lines without making you look like Goldie Hawn in the First Wives Club. Go there, I'll say it.
Now, the question though, if you're injecting something into the lips, A, does it hurt? B, does it restrict the movement of your mouth?
It's a really good question. I mean, people respond differently to the products. It shouldn't hurt. In the office, I will give you a block so that your lips really should be totally numb, and therefore the procedure is not painful. But different people respond differently. Different people get more or less swelling, and so it can be up to 2 weeks before your lips really feel soft. Not that you would look odd, but you'd be aware of it. But there really isn't a recovery.
Now, Deborah was calling them estrogen lines. I'm imagining just because you lose the, the pliancy.
Well, certainly without our hormones, you know, all things change. But you know, I love that phrase, but it's a new one on me. So
she also mentioned something about from the nose. That would be the nasolabial.
That's probably the nasolabial folds. And again, those are formed with aging. They're a combination of lines getting deeper, but also of shifts in facial volume. So the cheek fat that starts all the way up here kind of falls over this retaining ligament of the face and makes these furrows look very deep. So again, restoring volume in here can often correct this in a very natural looking way.
And again, the thing that you're injecting into your body, I mean, it's a concern. What is this, and how safe is it?
Hyaluronic acid products are made with recombinant DNA. They're identical to the hyaluronic acid that's already in our body and all our joints. And a lot of people are very comfortable with that. The radiesse, which is the other major product that I use, is calcium hydroxyapatite, completely foreign, but has been used in treating bone fractures for about 30 years in this country, and has the added benefit of stimulating your body to make more collagen in the area where it's injected.
So having your body work for you.
Exactly.
We need to take a break, but for more information about Dr. Elizabeth Lee, call her yourself, 510-704-2170, or check her out on the web at artfulsurgery.com. She's having some specials this month. You can see them right there on your television set. I'm not going to actually run down everything. It is a virtual Santa's bag of
because
goodies.
I want you to be able to come in and get the full correction that you need.
All right. When we come back on Body Beautiful, we will continue our chat with Dr. Elizabeth Lee. We'll also take your phone calls.